Assessment of vital signs. Step 1. Assessment of pulse rate. Explain the procedure to the patient.
Hi ma'am, I'm going to assess your pulse rate. May I please touch your wrist? Sure.
Locate the radial artery in a conscious patient or carotid artery in an unconscious patient. Count the number of pulsations for 30 or 60 seconds. Report the pulse rate, rhythm and strength.
The patient has a heart rate of 80 beats per minute.
Findings need to be verified by the vet, by the assessor. Step 2. Assessment of respiratory rate. Count the number of breaths for 30 or 60 seconds. Report breathing rate, rhythm and depth.
The patient has a respiratory rate of 14 breaths per minute.
Findings need to be verified by the assessor. Step 3. Assessment of blood pressure. Explain the procedure to the patient.
Ma'am, I'm going to now assess your blood pressure. This cuff is going to go around your arm. It's going to inflate and it's going to put pressure on your arm. It will only do that for a few minutes, maybe a few minutes. And then it will deflate. It may cause you a little bit of discomfort.
Check for any injury to the arm. If present, use the other arm. Expose the patient's arm. Wrap the cuff snugly around the patient's upper arm. The lower border of the cuff should be approximately 2.5 centimeters above the antecubital space. Support the exposed arm at the level of the heart and palpate the radial artery.
Now if you can just place your arm on the leg there. Thank you.
Grasp the ball pump and close the valve. Inflate the cuff to just above the point where the pulse is no longer palpable. Place the diaphragm of your stethoscope over the brachial artery. Deflate the cuff slowly in increments of 2 to 3 millimeters of mercury while observing the blood pressure gauge. Note the systolic and diastolic pressures while slowly deflating the cuff. Deflate the cuff quickly and completely once your systolic and diastolic readings have been obtained. Now using a non-invasive blood pressure monitor. Ensure that the NIBP is calibrated and the monitor has been serviced. Ensure that the monitor has power or charged batteries. Attach the cuff to the exposed part of the arm. Press the start button on the NIBP monitor. Wait for the monitor to inflate and deflate the cuff and display a reading on the monitor. Record the reading in millimeters of mercury.